Hello, welcome to the Helen Bader Foundation CBRF Caregiver Training Program. This unit is on the management and administration of medications in the CBRF. It's divided into a number of videos with their own individual workbooks. This is part 6, the basics of drug therapy. It's important for you as a caregiver to have a good understanding of the basics of drug therapy, particularly in the elderly. I'm Marin Meyer. I'm a pharmacist. We've met in the previous units, and I'd like to welcome you back. As always, we begin each part of this unit with a pretest. Just to remind you, the pretest and post-test questions are identical. The questions are designed to give you a feel for what kind of information you already know and what kind of information we want you to learn more about and to gain a greater understanding of. The test is not graded in any way. Turn off your video now and complete the pretest and then come back. Welcome back. Now in part 6, we're going to talk about the basics of medication therapy. In this unit, we're going to discuss who can prescribe, how prescribing is done, who can take orders, and what correct orders should look like. We have some lists and a poster for you here in the handbook. And then you will see and hear procedures for actual administration of medications. So let's go right into it. Who is allowed to prescribe a medication or drug? Physicians, including MDs, DOs, and podiatrists and dentists are allowed to prescribe medications. In addition, in Wisconsin and in a number of other states, physicians, assistants, and nurse practitioners can prescribe under the supervision or direction of a physician. In several states also, but not in Wisconsin, pharmacists can prescribe medications. So how does a physician or other authorized prescriber write for a drug or medication? Normally, you receive written orders either on a prescription blank or on the discharge summary from a hospital or nursing home, or you may get it from the physician's appointment form. Written orders can be relayed to the pharmacy via fax or by direct delivery in person by the resident themselves or by you, the caregiver, or they can be called from the doctor's office by a nurse or LPM by telephone. Oral orders can only be received in the CBRF from a physician by an RN or an LPN. And they can transcribe then the oral orders into writing. Who is allowed to take a written or verbal order from the physician? Well, the pharmacist, an RN, including the physician's assistants or nurse practitioners, LPNs, or the RN and LPN may also take verbal orders from a pharmacist who has taken it from the physician, him or herself. Verbal orders from a physician should never be taken in the CBRF by anyone who is not an RN or an LPN. What kind of written orders are there? There are standing orders that are good for an indefinite period of time. An example of that is give 1 aspirin daily to prevent heart attack. That order is good until the doctor discontinues it. There are self-terminating or automatic stop orders, and those are medications that are ordered just for a specific period of time. An example would be antibiotics that are given for 10 days. All antibiotic orders should have a stop date on them, and that includes orders for, say, eye antibiotics. Narcotics have automatic stop orders. And some steroid therapies will have a distinct amount of time for which they are to be given, and then they shouldn't be given past that time. So, what should a drug order look like? Well, it shouldn't usually look like it does. I'm going to tell you the things that really belong in that order. And wishfully, you would see that in a print that would be totally legible to you. It would include the resident's name, both first and last name, the date of the order, including the day, the month, and the year, the name of the drug, which would be next to the RX. Okay, the name of the drug can be written either as a generic or as the brand, and depending on what kind of insurance the individual has, that medication may need to be dispensed as a different brand than the physician specified. But in Wisconsin, the pharmacist must consult the patient about making that change before it's done. We have the dosage, the amount of the drug, and the strength of the drug. So for example, if we said aspirin, 325 milligrams would be the dosage. The route of administration, is it orally, rectally, vaginally, by inhalation? You have the physician's signature, and without the physician's signature, written orders are not valid. You have the number of refills that a prescription is good for. With some medications, particularly the Schedule II medications, there are no acceptable refills on those. And as we discussed in a previous unit, there are limits on the numbers and time periods in which some of the other controlled substances can be refilled in. There are labeling instructions. The labeling instructions are the SIG, and that's S-I-G with a colon after it. The SIG tells the pharmacist what to put on the label. So it may say IBID, and that means 1 twice daily. It tells the quantity, how many tablets or units should be dispensed. And finally, if the prescription is for a medication that has a controlled substance in it, you'll have the physician or prescriber's DEA number. The DEA number is a number assigned by the Drug Enforcement Administration, and it's a unique number for each prescriber. We've given you an example of what a prescription blank looks like. I'm sure you've seen these before. Some have more information, some have less. In the cases where a physician does not want a product substituted, they must write on the face of the prescription, brand medically necessary. And it must be written in the physician's own hand. Now under G, standard medical abbreviations. The abbreviations that you see on prescriptions are normally, they're a kind of shorthand just to keep it from taking forever for physicians to do their book work. Most of the abbreviations that you see are a shorthand of Latin, and that's why they don't seem to make any sense. Most of the standard abbreviations are familiar to most people who are in the medical field. But some people use non-standard abbreviations, so don't guess if you are not sure. And certainly don't become part of this growing problem of people making up their own abbreviations. Write out your directions. Don't make something up, because in a year or even in a week, you may not remember what your abbreviation stood for. When you administer medications, there may be instructions or abbreviations that are not totally clear to you. Always clarify those. And if you have to go completely back to the original source of the directions, that would be the prescriber. If you must do that, it is very important to do it, because the abbreviations, for example, on the next page, if you look at AU, that means both ears. If you look at OU, that means both eyes. If you have a resident who is not totally sure what they received or what was being treated, it would be very easy with the slip of a pen to make an O look like an A. So you might be administering something to the ears that should be administered to the eyes, or vice versa. So don't guess on those. We try to discourage CBRF caregivers from receiving orders in Latin abbreviation, simply because these are very difficult even if you use them all the time, and they're more difficult if you don't use them all the time. But these next 2 pages have some of the most frequently used items. For example, BID means twice a day. QHS means at bedtime. RX means a treatment or therapy. When you get to something like grams versus milligrams versus micrograms, be sure to check with the pharmacist, because those are factors of 10 by which the strengths would vary. So you certainly don't want to make a mistake that's a factor of 10. In H, we have some of the simple measurements. Now, to totally confuse the issue, there are many different systems of measurement. If you look in your dictionary, you'd be just amazed at how many types of measurement there are. When people say, oh gosh, metric is just out of my league, well, wait until you get into apothecary, for heaven's sakes. So it's important to know exactly what system was being written in when a prescription or an order was given. Household teaspoons and tablespoons are never considered accurate measuring devices, so don't use those. Ask the pharmacist to provide you with an accurate measuring tool. In pharmacy practice, and therefore in your practice also with medications, a 1% error is acceptable, but a 5% error is unacceptable. So that would mean if you made, instead of giving 100 milligrams of a drug, if you gave 106 milligrams, then you would have made a medication error. Likewise, if you gave 94 milligrams, it would be a medication error. So be sure that you end up measuring things accurately. A lot of times the little medicine cups that come with medications are not accurate enough for some of the medications that we use in them, particularly medications like Dilantin, where the dosage is very carefully calculated. Never guess. Always do your measurements at eye level. And if you don't feel terribly skilled, or if you're just having a bad day, or it doesn't seem right, check with another person, because usually you need to trust your instincts. If you think there's something wrong, there might be, and you don't want to risk that. On the next page, we've listed some of the simple measurements. They are like the teaspoon is 5 mLs. You need to memorize that one because you'll see it a lot. A tablespoon is 15 mLs. And you want to also learn the average doses of medications. In one of the courses that I taught, we had a question about, is 5 mLs of milk of magnesia a reasonable dose for a laxative? No, really it's not. You need to realize that milk of magnesia is usually given either 15 or 30 mLs. So that kind of just ballpark idea is going to help you out a lot. I tried personally, even as a pharmacist, to avoid drams, fluid drams. They're very tiring. There's another group that's called scruples. Anybody still working in scruples is not in a high-tech state of mind. You do need to know about cups, tablespoons, and their conversion to cups, and how many ounces are equal to a certain number of mLs or milliliters. So you can use this chart as a reference, and I'd hang on to that one. Let's go on to I, categories of drugs and medications. This is probably familiar to you from another unit. Sometimes we will cover information a second time just to make sure you're totally clear on that information. We have 2 major categories and another category, and the major categories are prescription and non-prescription drugs. The third category, controlled substances, are also, not only are they controlled substances, but they are also prescription drugs. Prescription drugs have to have a physician's order, or a physician or a licensed prescriber's order. Over-the-counter medications can be bought without a prescription and are considered safe provided they're used according to the directions on the labeling. And you need to remember, of course, that non-prescription medications can interact and are true drugs. Controlled substances, if you recall, are divided into 5 schedules, with Schedule 1 being drugs of abuse with no medical purposes in the United States, for example, crack cocaine, and Schedule 2 being extremely strong narcotics or drugs that have a very high potential for abuse or addiction. And then the other schedules, which people have a tendency to either overuse or kind of get into trouble with or need a lot of monitoring. So be sure to read through this information again. Under J, we have forms of drugs or medications. 1, liquids and semi-liquids. Tinctures are made of alcohol or water and alcohol. Elixirs are a clear fluid for oral use that contain primarily water and alcohol. Syrups are medication dissolved in a concentrated solution of sugar. Flavors are used to mask unpleasant tastes. And some of the more frequently used flavors are cherry, which masks bitter taste extremely well, and grape. And many younger patients seem to really like the grape flavors. Emulsions are suspensions of oils and fat in water and must be shaken before being used. Magmas have heavy particles that are mixed with water to form a milky liquid or paste, and those also need to be shaken before using. Suspensions are finely divided, undissolved substances dispersed in a liquid base. An example that you see very frequently would be amoxicillin suspension. Those suspensions need to be shaken before using. Liniments are mixtures of drugs, water, alcohol, oil, or soap and are used for external use only. Lotions are suspensions of drugs in a water base for external use, and they need to be shaken. Anytime you see a product that is not totally clear or that you cannot see through, even though that it may have a color to it, you need to remember to shake that before using it. Ointments are drugs mixed in a lanolin or petrolatum base. Transdermal products are fat-soluble drugs that are applied in the form of a patch. The medication is absorbed through the skin. Sprays are liquid medication dispensed as a vapor. Sometimes sprays are also a powdered medication dispensed in an aerosol medium. Solids and semi-solids. Powders are fine, dry particles of drugs mixed with powder. Tablets are drug powders that have been pressed and molded into small discs. Pills are a mixture of a powdered drug and compressed into a pill or disc form. The words pill and tablet are used fairly interchangeably. Capsules are powdered or liquid medication within a gelatin container. Delayed release tablets and capsules contain several doses of medication and have a special coating that dissolves each dose at a different rate. Never crush, open, or empty a delayed release tablet or capsule. Enteric-coated tablets and capsules are tablets and capsules with special coating to keep them from dissolving in the stomach. They dissolve when they reach the intestines. Be sure that you never crush these or mix them with food or liquid either. Troches and lozenges are tablets designed to dissolve in the mouth and release the medication for action in the mouth or throat. Suppositories are medications that are mixed in a firm base, such as cocoa butter or glycerin, that melts at body temperature. They're used for insertion into the vagina, rectum, or urethra. Under K, we have a chart for you of the routes of administration. This handout is similar to information we discussed in a previous part of this unit. On the next page is a poster that we'd like for you to post in your CBRF to remind everyone, not just staff members, but everyone, about hand washing. Hand washing has been demonstrated to reduce the incidence of illness by just an incredible amount. And it's so easy and it's so inexpensive. And throughout M, procedures for routes of administration, you'll see that every procedure for administering drugs requires that you wash your hands both before and after the procedure. So you'll get tired of hearing me say this, but I'm going to harp on it until it just becomes second nature to you. So let's start on the procedures for administration. Oral medications are medications that are intended to be taken by mouth and swallowed. Oral administration is the easiest, safest, and most economical method of administering medications. It is also about the slowest in onset. It may come in the form of liquid, tablets, or pills. Now, throughout this section, what I'll do is I'll offer you some examples of each type of medication, and then I'll describe the procedure for administering the medications. And that'll be demonstrated in the video for you. So let's start with capsules, pills, or tablets. Number one, wash your hands. That means wash with soap and warm water, wash aggressively, rinse aggressively, and dry well. Next, you need to determine if the medication should be given with food. Should it be given on an empty stomach? Be sure you don't touch the medication with your hands. Depending on your CBRF's medication system, the medication may come in a single pod as a unit dose, in which case you open the pod, pour the prescribed amount into the medication cup for the resident without touching it with your hands. If your medication comes in bottles, pour the prescribed number of tablets into the lid first and then into the resident's medication cup. Don't touch it with your hands. Have the resident moisten his or her mouth with water and swallow a small amount of it. Have the resident place the medication in the back of their tongue. Have the resident take a drink of water and swallow. It's best that a full glass of water, 6 to 8 ounces, is taken with an oral medication. If a resident is unable to swallow a capsule or pill or tablet, it may have to be opened or crushed. Before opening or crushing any oral medication, check with the pharmacist if the medication can be crushed or opened. Some cannot and should not be opened or crushed. Check with the pharmacist if the medication can be mixed with things like applesauce, ice cream, or pudding. Make sure the resident is aware that the medication is in the food source and has agreed to receive their medication in that manner. Remain with your resident until all medication is swallowed, and then wash your hands. Let's go on to liquid oral medications. The first thing, of course, is to wash your hands for at least 20 seconds and dry them thoroughly. Shake the medication if directed. When opening the medication, point it away from you because some liquids build up pressure inside the bottle. Don't touch the medication with your hands. Hold the container at eye level. Pour the liquid on the side away from the label so you don't damage the label. If you're measuring a teaspoon, use a medical teaspoon, not a household teaspoon, for accuracy. If measuring more than a teaspoon, use a liquid medicine cup that has the measuring guidelines on it. When giving a liquid medication with other medications, the liquid medication should be given last. Check to see if a liquid medication can be diluted with water, and if so, a drink of water can be offered between swallows of the liquid medication. Cough syrups should not be diluted and should not be followed by liquids. Remain with the resident until all medication is swallowed. Recap tightly and return to the proper storage area. Now, before you return it to the proper storage area, If you've gotten drops of medication on the outside of the bottle, be sure to clean that bottle off and then wash your hands. Let's go to sublingual medications and buccal drugs, which are 2 and 3, and are administered in very similar fashions. Sublingual medications are medications or drugs that are given by placing them under the tongue, and it's a very rapid and complete method of absorption into the bloodstream from the lining of the mouth. Usually it's absorbed within 1 minute. First, wash your hands. Have the resident moisten his mouth with water and swallow a small amount. Instruct the resident that you are going to place a tablet under their tongue and that they are not to eat, drink, smoke, or chew gum for 5 minutes or until a tablet is dissolved. Instruct the resident that he or she must not chew or swallow the tablet. Pour the prescribed amount of medication into the resident's medication cup without touching it with your hands. Instruct the resident to lift up their tongue and then pour the tablet under it. If the resident is unable to lift their tongue up, it may be necessary for you to assist them, in which case you should put on disposable gloves and assist them in lifting the tongue. Remain with your resident until all the medication is dissolved and then wash your hands. Now, the buccal medication is a medication that's designed to be put between the gum and cheek or under the lip. And it's designed to release a dose of medication over a fairly short period of time. First, you would wash your hands. You would moisten the resident's mouth by giving them some water and asking them to swallow a small amount. You would instruct them that you're going to place the tablet between their gum and cheek or under their lip so that they are not to eat, drink, smoke, or chew gum until the tablet is dissolved. Then, tell the resident that he or she must not chew or swallow the tablet. Put the prescribed amount of medication into the resident's medication cup without touching it with your hands. Have the resident place the tablet between his cheek and gum or under their lip. And if unable to do this on his own, you might need to don disposable gloves and assist the resident in doing it. Regularly check the resident during the 3 to 5 hours it takes the medication to dissolve. Then wash your hands right after administration. Let's talk a little bit about topical medications and drugs and some of the forms that topical medications come in. This drug type is applied to the skin, the ear canal, the eyes, and the nose, and is used for its local effect, but sometimes also it is intended to be absorbed into the bloodstream. Let me describe the nature for you of each type of topical medication. Liquids are a substance that flow easily. They're a fluid, and they're used for many purposes like eye drops, ear drops, nose sprays, medicated mouth rinses, eye washes, astringents, antiseptics, antibacterials, and topical irrigations. Their purpose is to soothe, cool, dry, protect, and lubricate the skin. Creams are an emulsion of oil and water in a semi-solid form. They are intended to lubricate, prevent loss of moisture, and they're used in the treatment of minor lesions and rashes. Liniments are a medicated liquid containing oil, alcohol, and water. They're used for muscle strains and aches and do have questionable medical benefit. However, my own grandfather always swore by liniments. Lotions are insoluble powders mixed with water that provide a cooling effect. They're protective, drying, soothing, and they're used on skin lesions like rashes and for itching. They are not washed off between applications. Ointments are a greasy, semi-solid suspension of oil and water called a salve or unguent. They protect the skin and help prevent the loss of moisture. And they're used to treat chronic skin lesions. Powders are fine, dry, dust-like particles. They're used as a barrier, and sometimes they're mixed with other liquids. They're used to prevent irritation, and they're very soothing and drying. Sprays are a fine mist in an aerosol or pump spray. Transdermal patches are a disposable patch that contains a medication that's slowly released through the skin and into the bloodstream. Some transdermal patches are used just for their local topical effect also. Topical medications for ears. The ears are treated with ear drops or ear washes for infections, fungi, inflammation, and with anesthetics to relieve pain. Some of the liquid solutions include things like Debrox, which remove earwax. This is the procedure for administering eardrops. Wash your hands. Did you hear that before somewhere? Put on disposable gloves. Be sure the eardrops are at body temperature. You can accomplish that by just rolling them between the hands. You want to do that to prevent any shocks to the auditory nerve, which could cause dizziness. Position the resident lying down with the affected ear up or sitting with the head tilted to the side with the affected ear up. Grasp the upper side of the ear and pull back gently and to straighten the ear canal. Without touching the ear with the dropper, release the prescribed number of drops into the ear canal. Instruct the resident to remain lying or sitting up with the affected ear up for several minutes. Use cotton balls only if directed. Discard your gloves and then wash your hands. Let's go on to eye medications. The eyes are treated with sterile solutions and ointments, and these are for diagnosing conditions, for treating infections and inflammation, for flushing out foreign particles, for treating eye diseases, and also for treating dry eyes, which is a common problem in elderly people. An example of eye liquid solutions is Timoptic, which is for glaucoma, or isoptocetamide, which is for infection. To administer eye drops, first wash your hands for 20 seconds. Put on disposable gloves. Don't touch the dropper. All eye medication is sterile. That's one of the reasons that it's so expensive. Position the resident either sitting up or lying down with the head back, chin tilted up. The resident's head should always be tilted to the side so that any excess eye drops drain away from the eye and don't go directly into the tear duct, which is near the nose. Gently pull down the lower lid to form a gutter or pouch, which is the eye sac. Without touching the dropper to the eye, hold the dropper close to it. Use your little finger to steady the dropper as you hold it. Release the proper number of drops into the pouch. Let the eye close gently. Discard the gloves and then rewash your hands. Eye ointments. Some examples of those are boric acid ointment, which is for inflammation, and gentamicin ointment, which is a sterile ointment for infection. To administer eye ointments, first, wash your hands, even though you're going to put on disposable gloves. Don't touch the ointment tube tip to the eye or your hand. Gently pull the lower lid down and instruct the resident to look up. Position the tube close to the lower lid. Squeeze a fine line of ointment along the inside of the lower lid, moving from the nose to the side of the face. Twist the tube slightly to release the line of ointment. Instruct the resident to close the eye and roll the eye from side to side without pressing on the eye with a hand. Wipe away any excess ointment with a clean tissue. Discard your gloves and rewash your hands. Topical medications, including liquid, cream, liniment, lotion, ointment, powder, spray, and some examples of those are Lotrasone, Caladryl, Neosporin, Domburose, and Granulex. To apply this type of medication, first wash your hands. Then apply the drugs as directed. In general, creams, liniments, lotions, ointments, liquids, powders, and sprays are rubbed in by hand or patted or swabbed on the surface, painted on, or sprayed on. You need to remember that only the drug that is in contact, direct contact with the skin is actually effective, and everything else is just wasted. Sometimes you may have to pat these products in with a cotton ball or with your hand. Sometimes you may be directed to apply the drug with a cotton swab like a Q-tip. Before applying any topical drug, put those disposable gloves on. Open the container, place the lid upside down on a clean surface like a clean piece of paper towel. Squeeze or pour out onto your gloved hand the amount you will need for one application. When using powders or sprays, make sure the resident is protected from inhaling the drug. Never touch an applicator or your gloved hand to the medication container after applying it to the resident. You apply the drug as directed, discard your gloves, replace the cap, and wash your hands. Topical medications in the form of transdermal patches. This medication is given by applying a patch that contains medication in it, and it's applied directly to the skin. An example is the nitroglycerin patch for angina or the estrogen patch for steroid therapy. To administer these medications, first, wash your hands for 20 seconds. I'd probably use lots of water to rinse them with. Put on disposable gloves. Apply the prescribed amount of drug to the patch, or if it's a patch that already contains drug, remove the patch from its wrapper. Be careful not to touch the medicated portion of the patch. The patch should be applied to a clean, hairless site, such as the chest, upper arm, or back, or as directed. The site should not be subject to excessive motion. Some transdermal patches require that the sites are alternated to eliminate the risk of irritation. Apply the patch and make sure the adhesive edges are adhered to the skin. Direct the resident not to remove the patch. After the patch is removed, the area should be gently cleansed with soap and water and patted dry. Report any redness or irritation at site areas. Then remove your gloves and wash your hands. Inhalation medications. These medications are given by having the resident inhale them into his or her nose, throat, or lungs. The drug may come in the form of nasal sprays or inhalers, and the inhalers come in many different forms and devices. The drugs are to be inhaled. They're either in the form of gases, fine droplets like sprays, mists, or steam, and are used for asthma, bronchitis, and emphysema. Nasal sprays, for example, include Afrin or Nasalide, which is for inflammation. To administer nasal sprays, first, wash your hands. Put on disposable gloves. Position the resident in a sitting position. Instruct the resident to breathe through his or her mouth. Place the tip of the nasal spray in the nostril. Instruct the resident to take a deep breath through his or her nose, and at this time squeeze abruptly and spray the bottle quickly to whatever amount is directed, usually 2 or 3 sprays. You can give 1 spray at a time and then have your resident wait and do another spray later if that works better with the particular resident. Wipe the excess with a clean tissue. Give any other instructions as directed to the resident. Discard your gloves and wash your hands again. At this point, your hands are probably getting a little dry, and you might want to keep some lotion around the facility, but be sure you're doing this hand washing. It is really important because everything that you touch is going to be transmitted to your residents, and you don't want to be giving people needless conditions. Let's talk about oral inhalers. Oral inhalers are normally used for conditions like asthma or emphysema, and some examples are Proventil or Flunisolide, which is used for inflammation of the lungs. First, to administer these, you want to wash your hands. Position the resident in an upright position. Shake the inhaler if directed. Hold the inhaler upright. Place the mouthpiece of the inhaler near or in the mouth. Instruct the resident to breathe out comfortably. Place the inhaler in the resident's mouth and press down on the inhaler, releasing one puff. Instruct the resident that he or she is to breathe in as deeply as you push down on the inhaler, and that they should hold their breath as long as is comfortable, and then breathe out slowly. Follow the instructions on how long to wait between puffs. After doing this, be sure to wash your hands. Let's talk now about rectal medications. This medication is given by inserting it into the rectum. Rectal drug administration may be the best route if a person cannot take oral medication because of vomiting, nausea, or unconsciousness. Rectal suppositories are commonly used to stimulate bowel movements. Rectal drug administration is also used when a drug is changed or destroyed in the digestive tract. Rectal drugs are designed to melt at body temperature, but the rate of absorption is uncertain when administering drugs rectally. Some examples of rectal medications include aspirin suppositories, which are fairly unpleasant, and I would suggest acetaminophen suppositories, or bisacodyl suppositories, which are used for constipation. To administer rectal products, first, wash your hands. The administration of a rectal drug is embarrassing for many people, both the administrator and the patient. So be sure that you provide privacy and proper covering or draping of the resident. The best time to administer a rectal drug is after a bowel movement, but this is not always possible. Position the resident on his or her left side with the right knee bent and appropriately draped. Put disposable gloves on. Sometimes a lubricant is required, for example, KY jelly. Remove the drug wrapper and lubricate the suppository or enema tip. Gently separate the buttocks to expose the rectal area. Gently insert the suppository well into the rectum, beyond the ring of the muscle, the rectal ridge. The length of your index finger, 2 to 3 inches, should be deep enough. The resident should remain lying down for approximately 20 minutes or as directed. When the resident does have a bowel movement, note the appearance of the stool and report it to the appropriate source. Discard your gloves, wash your hands, and reassure your resident. Vaginal medications and drugs. These drugs are given by inserting them into the vagina. Most vaginal drugs come in creams, suppositories, ointments, foams, or tablets. Some vaginal drugs are inserted via an applicator or plunger. The vaginal medications are given for infections, fungi, inflammation, birth control, and as anesthetics. Some examples are Premarin suppositories or creams and gyne-lotrimin creams or suppositories, which are used for yeast infections. When administering vaginal preparations, wash your hands for at least 20 seconds. Maybe you could develop a little tune that you know is 20 seconds long, so you know how long you're washing and rinsing your hands, and then dry them thoroughly. The administration of a vaginal drug can be embarrassing for most people, so be sure you provide adequate privacy and proper covering or draping of the resident. Instruct the resident to empty her bladder prior to insertion. Position the resident on her back with her knees drawn up with appropriate draping. Put disposable gloves on. Gently spread the outer lips of the labia. Insert vaginal suppositories, creams, ointments, foams, or tablets as directed, either with a gloved finger or the applicator plunger directed toward the back, the small of the back. Never return a gloved finger or applicator to the supply source or tube after insertion into the vagina. The resident should remain lying down for approximately 20 minutes or as directed. A sanitary napkin is generally suggested to protect the undergarments from staining and moisture. If the plunger requires washing, you should do so before discarding your gloves. Then discard your gloves and wash your hands for 20 seconds. Now I want to cover a little bit of information about parenteral drugs. These medications are administered by injecting them into the body with a needle and syringe. Parenteral administration gives very rapid absorption and distribution of drugs, and the dosage can be controlled very carefully. All parenteral injection equipment must be sterile. The potential to cause serious infections exists if correct techniques are not used. Parenteral routes are divided into 4 main categories, and I'll discuss those for you. And they are divided up based on where the medication is injected. First, there's intradermal. Intradermal is when you inject a small amount of medication just beneath the outer layer of skin, and the absorption is very slow in this type of injection. A couple of examples are the TB skin test and also some of the allergy shots that people get. Another type is subcutaneous. Subcutaneous is when drugs or medications are injected into the fatty tissue that lies right below the skin. And that's the type of administration we use when we inject insulin for diabetes, or sometimes when xylocaine is injected for a local anesthetic effect. A third type is intramuscular administration. This is when we inject the medication deep into the muscles. The absorption is faster than the absorption from the skin layers, and the muscle can absorb a greater amount of fluid without discomfort to the resident. Now, normally about 3 mL is the comfort zone. Anything above 5 mL can be very uncomfortable. Some examples of intramuscular injections are penicillins or other antibiotics, and also morphine, which is injected into the muscle for pain. The fourth type of parenteral administration is intravenous. Intravenous is when the medication is injected directly into a vein. This route may be necessary when the medication has to act immediately. This is the least safe technique to use. You really need to have skill to be giving intravenous medications. Some examples are running a bag of normal saline into a resident who's dehydrated, or giving Travisol, which provides calories to people who are malnourished. The state of Wisconsin regulations state that injections shall be administered by a registered nurse, or for a resident who's in a stable medical condition may be administered by a licensed practical nurse who is competent to perform the task. Now, administering an injection may be delegated by a nurse to a CBRF staff member, provided that is administered under the supervision of the registered nurse. We're not going to cover the actual demonstrations of parenteral medications here. That would be something that your facility would want to have its own policies and procedures and trainings for. Let's wrap up Part 6, the basics of drug therapy, with the post-test. As you recall, the post-test and the pre-test questions are identical. There's no grading. You're just competing against yourself here. I want you to be sure that you get at least 80% of these questions correct, or else go back and review the information and wash your hands a bunch of times. So turn off the video now, complete the post-test, and then come back. Welcome back. I hope you didn't have to wash your hands for that one. Let's go through the responses now. Number 1, under the direction of a physician's assistant, or a nurse practitioner may prescribe medication. This is true. Number 2, a written order is the only kind of physician's order. This is false. To be true, we would have to also include oral orders. Number 3, A caregiver in a CBRF may take a written or verbal order from a physician. This is false. Only an RN or LPN at the facility can take oral physician's orders. Number 4, 3 categories of meds or drugs are prescription, over-the-counter, and controlled substances. This is true. Number 5, oral administration is the fastest way for meds to get into the cells of the body. This is false. Oral is the slowest, but often the safest and often the most economical approach. Number 6, liquids and semi-liquids are forms of medications or drugs. This is true. Number 7, rectal meds should never be given to residents with nausea. This is false. Rectal administration is actually a pretty good route of administration for residents with nausea. Number 8, sublingual medications are administered by placing them under the tongue. That's true. Number 9, a topical medication is applied to the skin, ear canal, eyes, or nose. That's true. Number 10, washing your hands is always the first step in administering any medication. That's true. Number 11, a good method of measuring a teaspoon is with a regular kitchen teaspoon. That's false. The amount of liquid that's held in teaspoons from the kitchen varies from 3 to 8 mLs. You always want to use an accurate device that's provided by the pharmacy for the medication. Number 12, a direction for administering a medication is not clear. You would try to figure it out to the best of your ability and then administer it anyway. That's false. Oh no, you always check. This concludes part 6, the basics of medication or drug therapy. I want to remind you to lay in a good supply of soap and paper towels and hand cream. I hope this information has been useful to you, and I want to thank you for joining me for part 6 in the unit on medication administration and management in the CBRF.